Yes, good morning. My name is Cleopas Kiproti. Today I'm going to talk about cervical spine assessment and its special test in the subject physiotherapy in musculoskeletal condition, prepared by me, Cleopas Kiproti. So I'm a final year student, Bachelor of Physiotherapy at Marwadi University. So today I'm going to discuss about this topic. So let's go into it right now. So let's go to the introduction of it. The cervical spine consists of seven vertebrae, which start from C1 to C7. So responsible for neck movement, stability, and protection of the spinal cord. So the assessment is essential for diagnosing, managing neck pain and related disorders. So as you have seen from the image below that the cervical spine consists of seven vertebrae running from C1 to C7. So the normal alignment is this one, but sometimes it can be misaligned due to deformities, due to some of the condition, maybe due to fractures, due to the injuries. So that may lead to misalignment of the spine or malalignment. Okay, so we are focusing on the clinical history and observation while assessing this one, while assessing cervical spine. So we go to the chief complaint of the patient. We are asking the patient what are the complaint, what are the difficulties they are feeling. So like pain, stiffness, and rotation. So we go in terms of pain. We go to onset duration and aggravating factors. How did it start? How long have it occurred? So what leads to increase in pain? And again, we go to the relieving, what leads to the decrease in pain. So we go to observation of the posture. Also, we see how the patient behave normally where there is deviation in the posture and muscle. So on palpation and range of motion, we are going to palpate the spine. Maybe sometimes we can palpate and feel like there are some changes which deviate from the normal alignment of the spine. Sometimes we can feel even fractures at the spacing which are abnormal. So you can also see the paraspinal muscle and lymph nodes. Assess range of motion. We do for all ranges, all movement like flexion, extension, lateral flexion and side rotation. So we sometimes also we go to neurological examination. We monitor the testing muscle strength, MMT. We go to reflexes, and then we go to also to sensory testing. So these are the routes we are going in terms of reflexes. As you can see from here, for biceps we go to C5, brachial radialis we go to C6 dermatomes and myotome, and tricep we go to C7 myotomes. In sensory we go to dermatomes C1 to C4 to T1. So special test overview, we have a lot of special testing to check the deformities, to come into conclusion to say that this patient is suffering from this one. Maybe it is a fracture, maybe it is nerve root compression and everything. So we have a lot of special testing. In special testing, we have a lot, but here we are just selecting a few, like spelling test. This is to detect the cervical reticulopathy. So as you can see, the methods from this image here, and positive sign is radiating pain into the arms and the same side. So that is a positive sign in terms of this spelling test. So if we come to distraction test, we are just checking for the relief of nerve root compression. And the positive sign is relief of nerve root system. When the pain persists and we do this distraction test, and the patient says that um, the pain now is getting relief, so that is positive. It shows that there was a compression. So we go, another one is cervical vertebral artery test. So this is to identify vertebrophyseal insufficiency. So we are rotating the patient's neck after we extend and rotate for 30 seconds. So the positive side is stiffness, also, and nystagmus or fatigue. So we have another one like shoulder abduction test. So this indicates cervical nerve root compression. So the patient places the hand on the head and like have you have seen in the video below, the positive side is structure of pain. So we have another one like learning limit signs. So the purpose is indicate spinal cord movement involvement. So we do neck flexion as you can see in the sitting. So the positive side is electric sensation down the spinally. So that are only the few that I can discuss for now. Because of time, I cannot discuss a lot. We have a lot of specialties for the cervical spine. So in conclusion, we say proper assessment is crucial for accurate diagnosis and effective treatment. The special test should be used to in combination with clinical history and physical examination. Always consider red flags and refer the patient as necessary. Thank you.